Hey everyone, it is Smart Brown Girl, and we will be discussing today Thick by Trusty McMillan Cotton. Let me get it correct, the name. I'm Dr. Nicole Carter,
And I'm Dr.
and,
Anisha Blake.
and we'll be discussing Dying to be Competent. We just want to let you know that there is a content warning or trigger warning associated with this chapter. It does talk about um, infant mortality within it, and also some severe microaggressions and racism that takes place within the medical industry when it comes to Black bodies. So we just wanted to let you know that and let you know to take care of yourself um, whenever you need to throughout our discussion. And we'll
Absolutely.
get started. Hey, Juicy.
Hey. All right. So we are going to start off with a quote on page 81. So the first quote is, "But some of us being competent has always been an illusion. So does this ring true to you?" Um, So I guess it's important to kind of outline like what the chapter was about before we jump in. So part of what this chapter is looking at is she starts off with her experience being pregnant and then having some complications in her pregnancy. And what she's outlining is, even though as this highly educated Black woman that she is a competent person when we look at, like, on paper, her status. However, in every instance of her interacting with her doctors, the nurses, whatever, they did not receive her complaints or her um, descriptions of her symptoms as anything worth ringing the alarm on. And so, because of that, she has this conversation about, despite all kinds of efforts and her status on paper, she was still seen as incompetent at every segment, and there was evidence of that through these like microaggressions. So I
Yeah.
think that kind of gives us like a little bit of a snapshot about like what this chapter is about, and then we can maybe some of you all who are joining in can also answer the question as well. But does that ring true to you, Nicole?
Yeah. So I thought about the term illusion, but also the term competence.
Mm-hmm.
And right before that, on that, the paragraph before it, it talked about this political economy that sells us competence or the feeling that
Mm-hmm.
we're competent. And for me, that stuck out because, and it probably did for you as well. Like we're both in higher education, like we're professionals in higher education, and I think that is what higher education sells, this idea that like you get a degree and so
Right.
now you're all knowing. But in reality, you can get, as many degrees as possible
I have all the
and
degrees
still be questioned.
and still I can't get a break. But we're not gonna talk about me because I'm not gonna frame this through a higher ed lens because I could get there, but I'm not gonna do it today. But yeah,
Okay. But I mean, but in other, like in life,
Mhm.
period, like even with, things like self help, like the
Yeah.
books that you can buy to like listen, buy the pod or not the podcast, but buy this program online now, a digital
Mhm.
download, and
Yeah.
it'll help you become a better person. And you assume these things are telling us that provides us with the ability to be competent, but it is an illusion
Right.
because somebody has constructed this idea of who is competent and who isn't. So,
Yeah. And
yeah,
it's like we like much like beauty, right? Like how we think about who is competent and what it takes to be competent changes all the time. So, I think at the end it was talking about like, oh, so you can't get a job. Oh, you might as well get like a certificate. And that becomes a way that you can further develop your skills. Like everybody is trying to get this thing on diversity and inclusion certification from Cornell. And I'm just like, y'all, everyone has it. Cause I've been looking at like resumes over the last few months. And it's just like, these are, I don't want to call everything a scam, a scam, but these are about things that are a part of a capitalist structure that says like, you're never good enough. There's always a means to improve. And I think this is also like Kim from For Harriet one time, she was talking about how like Black women, we are like the self-improvement like queens. Like we are the people who um will do that self-work of, okay, how can I be better? How can I be better this time? And we will go out and really do that work. And so for us, like I think it's really important that people like, I mean, target us for a lot of these programs. And it's not an accident that a lot of these things um, are sort of marketed toward us because of that disposition of feeling like, oh, I need to actually do better, or I need to improve my myself or my status or whatever. And that's not, I'm not saying that as a bad thing. I'm just, because I think that I do it too, but I do see that happening quite a bit in like Black women communities.
Yeah. I
Yep.
think that connects to the next one because the next question asks us about our image of a competent person.
Mm-hmm.
So, what do you think that image is? What is that image for you? Or has it changed over time? Has it transformed?
Right. Um, I don't know what an image of a competent person or who I can really like draw on. I think about it like, is it a lot of aesthetics? Like, if someone has like very sharp lines in their like dress, or have like a very structured, like I think about what's that one show? What's that one movie called? Um, I Care a Lot, where the woman had this like
Oh yes,
cut and like everything was so sharp. And like you're supposed to believe that she's like this competent person, or that she knows like what she's doing. And I just think about like how much aesthetics get so tied into who we believe is competent,
yeah,
right? So there's so many markers that are being weaponized, right? That oftentimes are used to tell us like who isn't competent, or who, whatever. Like even people wearing glasses and they don't have no prescription, right? It's just like that. That's supposed to be a marker of competence.
right.
Mm-hmm.
That and so the aesthetics piece, and even well, the glasses associated with aesthetics, and like the tools of competence, like those things cost money. So, and I think she talks about that, the relationship between capitalism um, and this idea of who is competent. And you brought up I Care a Lot, and she also had money, right? I mean, for various reasons, but the money was associated with this competence. Like she had to have the money to have the aesthetic, and she had to have the aesthetic to come off as competent. So it's all connected together.
Mm-hmm.
But like my idea of a competent person has actually changed over time. That's why I asked that. But like when I was coming up, I think I thought of competent people as those who were like learned, right? Like they had degrees, they read a lot. You know, I didn't necessarily associate race or gender to that person.
Mm-hmm.
And that was because of my upbringing, though, like because my dad was a teacher, and my brothers. Went to college, graduated, master's degrees, like, so my idea of a competent person was different. But it changed now. The degrees mean nothing because it's a whole bunch of competent people who are stupid as
Ooh,
let me just
please.
say and so
No comment.
and so but I now see it as wisdom. Like competence is
Yeah.
like, what do you know, and how does that knowledge, so how is that knowledge associated with your experiences in life?
Mhm.
Like how has living life taught you to navigate this world in a way that is better than how you moved through the world before?
Mhm.
So it's different for me.
Yeah.
What about you? Like the specific image, do you have one? Or
I don't really, but because I guess I never really think about it. I guess to your point though, I can appreciate what you said about like having it evolve over time. I struggle with that because I think it really does have like I really have to think about. I have experienced moments in which incompetent people have had power over me or have had status, who have had positions of status over me. And so it's really hard for me to say, like, you don't have to have a bunch of degrees, but that's within my context, right? And I'm dealing with my own shit. But because I'm like, it's a whole lot of incompetent people right now that I can name that are not in positions that they should be. However, I think that like certainly that you have a good point in that like outside of that context or in just different contexts, we have to be mindful that what your degree is not a true marker of your ability or your status, and what you know in your life knowledge, right? Your lived experience and how your lived experience becomes a language or an analysis of the world and how to navigate it.
mhm. Yeah, it definitely. I don't. So I think I like from a Black feminist perspective, like experience is that
Mm-hmm.
knowledge, that competence, and so and I will say, I guess that's when that my idea changed,
Mm-hmm.
of like who is competent, what does it mean to be competent, because that like held true for me. Like
Mm-hmm.
I know how to move about this world because of experiences that I either had or like my grandmother had and she told me about, and so I was
Mm-hmm.
mindful about the things that she told me, or like different things like that. So
Yeah.
we had a comment. So it says, let's see, um I don't know if I can show it. Yeah. So it's sad that we don't feel competent when we're interacting with healthcare professionals concerning our own bodies.
Mhm.
And when we advocate for ourselves, we're often ignored, which is sad because we know our bodies better than anyone else.
Yes. And I
Definitely.
think that what she's pointed out is just because you don't know the language or you don't know the correct terminology, right? Like a lot of, and this made me think a lot about an interaction that I had with a few years ago where I was like describing this pain that I kept having in like my pelvic area, and I kept going and talking with different doctors. And eventually I got an ultrasound, but it was just like, I think that I wonder after she was describing like that back pain, she was like, my butt just hurts, right? And like, I wonder if like me not being able to articulate exactly where the pain was based on like these very Western Eurocentric like frameworks of how the body is or what should be where and where should pain be to indicate that it's a back pain versus a butt pain, right? And just because she didn't have that language, she's not able to, she's seen as incompetent, and it's now her fault that her pregnancy ended in the way that it did, right? And so like I think about that a lot. Is like how many of us just don't have like, I mean, I didn't take human anatomy. And so I don't know what different parts mean and what different pain means, but I know what I'm feeling. And so, and I think we had a conversation about this back when, I don't know what book we were reading, but just about how we don't even think about black, or we think that black women have a higher threshold for pain. And so oftentimes we don't think about like when we have that scale, the sort of standard scale of like on a scale from 1 to 10, how much pain you are, how much pain are you experiencing, and somebody says, "Well, I'm experiencing a 3." Well, like, what's a black woman's 3? Like, I feel like that might be, you know, a 10 in some cases, right? So that idea that like we might underestimate our pain because we've been socialized and conditioned to endure a lot of pain. And also, the system or the scale of pain is just not conducive to like our bodies.
Yeah. Yeah. You said a lot. So I have a lot of
I,
thoughts about it.
go ahead, because I
Like,
know you've
but
been.
mainly it just relates to like whose body was like the body, right? Like
Mhm,
they based these these ideas of like, well, pain tolerance and the pain scale on whose body was used, or what bodies were used to analyze pregnancies,
mhm,
right? To say like if it's a back pain or pain in your pelvic area, then that is normal. But
right,
if it's a pain in your butt, no, that's just gas.
right.
Like, so how do you know it's not changing or moving? And everybody literally is different. So it manifests differently, but
Mhm,
that wasn't, even considered whatsoever. And it's not, I think I was so angry reading this chapter, which I mentioned before we got on,
mhm.
because it happens so often. And I know for a fact that it's pretty much all of our, like, as Black women, a common experience that
Mhm,
our pain is minimized, symptoms minimized. We're thought to not know what we're talking about. So,
mhm,
yeah. And we're talking, I mean, there's a question directly about that particular section as well later.
mhm,
Uh, so I'll post this. So someone said, yes, the medical system at its core excludes non-white people. Symptoms of the same disease show up differently for Black people, but the medical field has historically excluded studies of Black bodies. Yes, yes, yes.
mhm.
And then someone said, word to Harriet Washington's Medical Apartheid, which is a really important text, um,
Yeah.
really, and the experiences of Black folks throughout this history, throughout history, and the relationship to the medical industry. So, um, here's another one. So when I had my C-section, I was told I have a high pain tolerance. I'm an RN, and that confused me. Pain is different from person to person, and pain can be different from one event to another. Yes.
Absolutely.
Yeah. And I mean, I've been told that as well. I have a high pain tolerance. But also like the amount of pain that you endure over time also changes your
Mhm.
tolerance as well. Doesn't mean that
Yeah,
it's not something going on, you
right.
know. So
Learn to deal with certain things and it
mhm,
numbs, but
yeah.
that's not.
Um, and
Mhm.
then Felicia said, "This reminds me of that doctor that died in Indiana from COVID." Yes,
Mhm.
yes, yes, yes. Like
Yeah.
she was telling them, like something is wrong. I know my body. I know
Mhm.
what I'm talking about. So even when you're a medical doctor or a nurse, it don't matter. It doesn't
Yep.
matter.
Yep.
Like so. But yeah.
Mhm.
So I can read the next question if you want me to. The next question asks, where do stories about competence emerge from? Who defines what is competent?
I think I think they. emerge from, all around us. I think we get messages about it both directly and indirectly from, our school system, right? How we interact with authority figures, our media, those are things, and even our own families, like, or neighborhoods in our communities tell us, even by the, like, who we call on most, or who we listen to, or when an idea comes to the forefront, who gets listened to, even when it's the same idea, right?
Mhm.
Like, I'm the only Black woman at, I'm not gonna say at my institution because that's a lie, but it wasn't a lie until like a few months ago. Um, and like just being in spaces where, you would say something and then your white colleague would be like, yeah, this, and this. And, you know, people are like, that's, yeah. And you're like, okay, so how do I need to say that so that it could get through to you at this
Yeah.
point? So I think we get all those kinds of messages.
Yeah. Um, when I was reflecting on that question, I just thought about like I think for me, family first was like the
Mm-hmm.
how I formed my idea of who was competent, and
Mm-hmm.
even that going back to that image, like because of my family, like going through educational systems, that was my idea of competence. So it was Black folks,
Mm-hmm.
but it was also Black men.
Mm-hmm.
So they were all men. But also, I, again, now like that idea of confidence, I mean, confidence, competence is also, it emerged from stories from like women in my family, but not
Mm-hmm.
necessarily, like formal,
Yeah.
like educational spaces or opportunities. It was like storytelling.
Mm-hmm.
So, but then I also think like so-called experts were always, told to listen to the doctor, take the medicine the way that they say,
Mm-hmm.
you're supposed to take
Yeah.
it. Well, what if that medicine is making it so I can't even function because I'm
Right.
nauseous all day?
Yeah.
Or what if this medication makes it so I can't walk? I actually literally had a conversation the other day with someone, a older Black woman, and she was on a particular medication, and this medication is for mental health. Okay, and she could not walk because it like did it was something, the dosage was off, and
Yeah.
yeah, like, but they
Yes.
don't.
Yep. That's true. I mean, my mom, like, she was taking a medication for, I think it was maybe blood pressure or something like that. And the dosage was just too high. And the way that it's supposed to help one thing, and then it's just destroying her at other place. Like, she's jittery, she can't
Mhm.
sleep. And I'm like, Mom, have you ever just considered, like, maybe the medication is just too strong? Like, and it took her a year to, like, they had to, like, go back in, like, adjust her dosage and, like, wean her off of it so that it wouldn't just be like a drastic, like, shock to her body. But, like, just even having that conversation with her, and, being like, hey, have you considered this? And I am not a doctor, right? Like, I am not a medical doctor. And so, you know, I think these conversations often happen in our communities, right? Where we'll just be talking about something and then we work it out in that way. And that gives us information. And if the doctor chooses to go with that and be like, oh, let's try this out, right? If they actually listen to their patients and kind of work through it. But a lot of doctors are like, no, don't listen to them. They don't know what they're doing. They just talking to you crazy. And then you're like, oh, okay, yeah. And we have to we mustn't forget that the pharmaceutical company is also there to profit. Okay, so when they giving you prescription after prescription, it's not always because it's just good for you. It is also a benefit to big pharma. So
Yeah. Oh, let me post it. So someone said, I worked in medical practices and many patients will call in and say my medication is causing this symptom. And when I bring it to the doctor, they would flat out say that the symptom cannot, the medication cannot cause that symptom. Yeah.
mhm.
Um, I mean, that's like basically what we're talking about. Like, but the thing is we've been taught to minimize and discredit like our own knowledge about our body. Like if something doesn't feel right, like
Trust.
we have intuition for a reason, and pain happens for a reason, swelling happens for a reason, all of these things happen for a reason. And they
Mhm.
tell us, like they're our body's way of telling us something is off or something is wrong or there's an infection, right?
Mhm.
Like or so but yeah, there's a disconnect, a major disconnect caused by many things.
Right.
But yeah. Um, you want to read the next one?
Yes. The author shares a difficult story about her birthing experience. While the medical practice she visited was viewed by others as competent, for a thick Black woman, it was not. Wait. While the medical practice she visited was viewed by others as competent, for a thick Black woman, it was not. She was competent in her knowledge about her body, which made a world of difference. Have you ever experienced challenges to your competency or knowledge of your body when engaging with medical professionals? Yeah, I think we've been talking about that. How did you navigate that experience? I mean, I can give another example if you, or do you want to share? I feel like I'm.
um I don't. I mean, well, we could both share, but like, and I think I've mentioned on here before that I have several autoimmune diseases, and often because autoimmune diseases are, there's nothing that can rid of them. They are just like, there. And so they're always trying different medications, different things, and they're always different symptoms as well. Again, like um, due to the body, so like that, like everybody's body is different.
Right.
But like my first, when I moved to Ohio and I like first got sick and I was going through all this stuff to try to, figure out what was going on. And they finally found out like what it was initially. Uh, like it was just a really bad experience with the doctor. I had to report her. And this is a woman of color as well. It was an Indian woman though, but um, and like when she found out that I had a PhD, she basically was like, "Well, you can read the material yourself." And I'm like, "Well, I'm asking you to explain this information. Like,
Right.
I'm not asking to read the material. Like, like this is your practice. Like, this is what you focus on. So please explain." Like,
Mhm.
so it was. We like went back to back. I also had a doctor here when I talked about my labs because I'm into that stuff. I want to know what's going on with my body. So I'm going
Yes.
to look at the labs. I'm going to look at the blood work, everything. I'm going to
Mhm.
research it myself. There's nothing wrong with that. It's nothing
Yeah.
wrong with researching things and having knowledge about your body and results and things like that. And my first meeting with this guy, um, like he was like, "Well, are you a nurse or something? So why I can't be a doctor, bruh?"
Oh,
First, but
okay.
he was like, "Are you a nurse or something? Because you just like know all this information." Well, no, I just looked up my charts.
Mhm.
So, but
Yeah.
yeah. So yes, I've had these experiences continuously. Um, and I advocate for myself, but that's been, I mean, I think that that is something that you learn over time. And
Yeah.
then some people never do that though.
Mhm.
But for me, it's like I'm here by myself in this state by myself. Nobody is here with me. Nobody is, you know what I'm saying? Like it takes 3.5 hours for somebody close to me to get here if something
Mhm.
happens. So I am advocating for me and I'm speaking up, and you can be mad all day, whatever. I don't care. But we going through these charts together.
Okay, one by one. That happened to me the other day. I went and got my blood work done, and my cholesterol was up. You know, my bad cholesterol was like on the borderline of being like too close. And so they wanted to. They were like, "Well, it's fine. We'll just get back with you in 6 months." And I was like, "No, I need to talk to the doctor today because if it's on the borderline, I need to figure out what I need to be doing to reduce my cholesterol in the 6 months before I come back so we can have another conversation about where I've been." But it was taking me having to have that extra step. Like, my next appointment is 6 months. We're not waiting that long. I need her to call me and we need to walk through it. And she went through every single lab. And I was like, okay, so now that we did that, let me talk about my thyroid. Okay, that's good. Okay. You know, and because they'll be like, oh, you're fine. I'm like, okay, what does fine mean? Like, what is consider, and even as I say, you know, normal is really not like, you know, that's kind of also made up, but give me some baselines about what's possible, what's normal, and then especially when it's cholesterol or anything like that, like let me know if I'm, you know, on the cusp of going over. So yeah, I think it's constantly about, you know, asking those follow-up questions and you know, taking control of, you know, our health, because they'll just be like, yeah, you're fine, go on, you know, and then you do your little copay and you go on if you have insurance. So you know.
Mhm. Yeah. Um, Diane also said, so Diane said, holistic medicine is not respected in many cases discouraged. Most of us are open to holistic or alternative options because those practitioners seem more open to listening to us.
Mhm.
Um, yeah, I don't know. So I also have an experience with that, but I focus more on a combination of things. But that same doctor that I mentioned, the first one, like she is like against all of those, like, so I don't know, like, so turmeric, right? For example, let's give it
Mhm.
an example. Good for inflammation, like to lower inflammation, right? And so if you have things like autoimmune diseases, it also like can boost your immune system. So it's really good for those things. I like mentioned that to her. Well, I don't know why that came up like that. I didn't tell you about that. Like so, but then I ended up in the hospital. Okay. And another, like the hospitalist on call from the same practice
Mhm.
provided like alternate options,
Mhm.
um, and was open to it. So it really depends on who you're talking to. But that doctor was he was also an Indian doctor. But I
Mhm.
mean, it's just some of them are like, I don't know. Like it's just it
We have to
depends.
talk offline.
So,
Yeah.
but yeah, but I don't know, like a lot, and talking about holistic or alternative options, like for me, being like deeply connected to like ancestral knowledge and practices and things like that, like holistic and alternative options were what our ancestors practiced, and even what our grandparents, great grandparents,
Mhm.
practice today. So mothers, fathers, they practice today,
Mhm.
because if something's not working, they're gonna figure it out.
Yeah.
So yeah.
Yeah.
But
Mhm.
um let's see.
We can go to the next one. Controlling images have fallen a bit out of favor in feminist literature. sometimes thought to be taken for granted relic of older theories. But that is only if we confine our analysis to popular culture, where negative stereotypes do seem pedestrian. When we broaden our field of analysis to the political economy of incompetence, who is and who is not structurally viable as a agentic being across the domains of social life, controlling images regain some of their explanatory power. So, who benefits from the controlling images created for Black women in the real world beyond popular culture? This is a good question because I
It's a
think
deep question.
yeah, that's where we often kind of start and stop with, like, looking at media and trying to map on all of these controlling images or tropes to offer our critique. And but what happens when those concepts get read onto Black women's bodies, especially in the medical and healthcare industrial complex, if you will.
Yeah. Um, I mean, I see. So, like, we're talking about medical professionals who don't value or listen to the experiences and the competencies of
Mhm.
Black women. And so I feel like medical professionals in the medical industry and the pharmaceutical industry, period, are the ones who um, benefit from those images because you know what they can do is just blow it off. Like, okay, she's just angry,
Mhm.
right? But that
Real right.
stereotypical image of the Black woman.
Mhm.
She's angry, and in that anger, like she's also ignorant.
Or she's
Um,
promiscuous,
yeah,
right? The assumption. I mean, there are so many uh, just harmful, interactions. Like, just thinking about, like, the assumptions that you come into, like, whether or not you're sexually active. um Most people assume that you're straight, right? That, like, I have had doctors ask me, like, do you have a boyfriend? And I'm like, wait, why are we going straight to boyfriend? Like, can we talk about partner?
we
Can we
just
talk
like partner,
about gender neutral
significant other.
right? And so,
But even that is like assuming partnering. You know,
right,
like
a
I
person,
could be out here living my life. How about it?
or
But
just any kind of assumptions about, if you don't take birth control, you must not be, like, having safe sex. Like, it's because it's like, well, some people don't have sex that would require them to need, like, contraception always in the way that we think, right? Or a traditional way that we might think of it. And so that, like, there are so many, like, heterosexist assumptions about, like, about who you are when you enter into, like, when you're just having a conversation, right? And I can even imagine just, like, what happens when you're a trans man or a trans woman and engaging in the medical world, like, how that process is even more violent, right? How those interactions are even more violent. So
and then you add intersections, a Black trans
mhm,
person
yeah,
with a disability.
right.
Okay. So like it's just
It just starts
complicated.
compounding, and, like, there's all of these kinds of assumptions. It was, I mean, like, I think it was so, and this is so sad because, like, I remember one of my doctors, or she was a nurse practitioner, she was like, are you having sex with men, women, or both? And it was like, oh, you didn't just assume, and I thought that was really, like, and the fact that I was, like, actually struck by it and, like, oh, that was really cool. I think that that's, like, it's really sad and unfortunate that people, that those little interactions or that little bit of care, but it carries a long way because you aren't making those assumptions about your I was gonna say clients.
Hmm.
Mhm.
And I mean, I think that goes to what Felicia said in the chat. that they need more intense cultural competency training. I'm assuming she's talking about medical professionals. Those courses should, yeah, those courses should be embedded within medical school,
Yes.
and they are not whatsoever. So I know, like, I even do trainings for chief residents, but by the
Really?
time they're at that point,
It's too late.
they're already working with patients. You
Yeah.
already have transformed the life of someone.
Yeah.
You
Yeah.
have created, like, you have perpetuated violence within their lives by not listening, by not respecting them, by assuming, by stereotyping them. And most of the people that I train look at me like, why am I here?
Right.
I'm just trying to check a box so
Right.
I can graduate officially, like lead this
Yeah.
thing. So, like, but yeah, and it is, so it's necessary throughout the entire process
Right.
of medical school, but also the people who are teaching them also
Yeah.
need that training.
Right.
So yeah, it needs a cultural shift needs to happen there. Uh,
Yeah, and this understanding, like with medicine, like in science in general, I think yes, like, but we have to realize like everyone's bodies are different, and so like we can't just have these static observations or static like this. If this happens, this means that. If that happens, this means that. Like we have to be more expansive in the way that we um, that we train up and coming medical professionals to read different types of bodies
mhm, yeah,
and also to engage with people at the level of where they're coming from with their culture. So like, everyone is not going to have the same like level of trust. And so how do you, gain that trust with your patients rather than treating it as, oh, they're not, they're again, this is another way of being like, oh, they don't know anything and they don't trust me. So it doesn't matter. And then that becomes a way to just kind of throw them away.
yeah, yeah. It does, like, rapport is definitely important, and a lot of the bedside manner of medical professionals sucks, quite
Mhm.
frankly. So, and they like to blame, like, well, if you would have took the meds the way that you were supposed to take it,
Right. Which
but
is what
how do
they're
you know? Like, I had money to go get, like,
still.
to go get the new prescription, so I started taking half so that it would last,
Yeah.
right? Like, so
Yeah.
I mean, there are so many things to consider, but there's another quote. I'm going to put it here. Um, and it says, I think this really gets to the point of what purpose negative stereotypes serve. We've gotten so wrapped up in representation that we forgot that the negative stereotypes weren't just for making us look bad, it was for justifying oppression and violence. It's longer, so I'm going to actually hide it because, uh,
Having
yeah,
having
justifying, huh?
oh go
Sorry.
ahead.
Oh, having smart black women on TV doesn't stop the medical industrial complex from disregarding black women. And
Mhm.
having black women as medical professionals doesn't disregard it. And
Mhm.
having black women as professors doesn't disregard it.
We have not seen Olivia Pope at the hospital, so we don't know what
So,
happened.
right.
But
So yeah, for me, those I mean, that is a great, a very important point, that it justifies a continuation of maltreatment, oppression, violence.
mhm.
Um, it has very real, consequences, not just like, oh, we making fun of, or haha, this woman's angry, right? So, or the strong black woman also has some very violent consequences as well, when we talk about pain and things like that.
Yep.
So,
Cool. Take
um,
okay.
yeah.
So the next question is, how have Black women in your life responded to efforts to apply these images to their lives? I don't don't know. I mean, I think a lot of Black women my age or around like my generation, I feel are like using these sort of like this analysis of the controlling image to like think about their own experience and to like have a name for it and and to be able to name it. Because I think even in the earlier chapters, like just the idea of naming what's happening to you and naming the violence is like only a small sliver, but it's such an important and critical step because many of us are told not to say anything about what we experience or to just kind of suppress it. And so just even taking the step to be like, what happened to me was not right. It was an act of violence and it was rooted in this idea that I'm promiscuous. It was rooted in this idea that I'm angry. It was rooted in this idea that I'm poor or I don't have the class status to be able to afford whatever, right? Like all of these different things. And so to be able to have that really, I think, helps to navigate. And I've seen a lot of Black women kind of in my generation be able to apply it in how they navigate all kinds of things, but specifically, you know, medicine and healthcare.
Yeah. I think for me, I can put Black women in my life right now in two categories. So there's a category who truly abides by notions of respectability, and then
Mm-hmm.
there are the women who like, like who are just like, I don't give a fuck about your stereotypes. They were constructed and they weren't constructed by me. So, and I think I kind of fit into this, the one where, like, I could care
Yeah.
less about your stereotypes, but it does get me personally. Often I get a talking to by people,
Mm-hmm.
like who, I just want to point out that you didn't have to put all that on your Facebook. I do, because you know what? Somebody is watching or somebody is reading, and maybe me talking about my mental health might help that person say like, okay, I can go to a therapist,
Uh-huh. Yeah.
or it's okay to not be okay, you
Mm-hmm.
know because I think we're a lot in this chapter. It talks about physical, like the physical health and competence and the connections, but it's also mental as well, like emotional health as well.
Right.
So
Yep.
yeah, like I've had my social media regulated several
What?
times.
Mm.
Snap, like people taking screenshots
See, and
and
sending
sending
them
them
to
to
you?
other people,
Oh,
and yeah,
and somehow you
then
said,
the person, and so I just nip it in the bud. Like, okay, so I heard that you have an issue with me. So what's the issue?
mm,
You
mm,
paying my bills, or what we doing?
okay.
Okay, so, but it is. I mean, so it's either. And I mean, I get it. I get like respectability. I get like abiding by those notions because it has led to success for certain people.
Right.
Um, and it's easier to like just align yourself with like normative notions of womanhood and of like American, you know, life, if
Right.
you will, or whatever. But I mean, I tell people all the time, like, I'm angry and I have a right to be angry.
Mhm.
Like, yeah, I'm an angry Black woman and I
Yep.
got a right. And I'm also loving. And I'm also,
Mhm.
like, I'm also caring and compassionate. Like,
Yep.
don't limit me to this one thing. But yeah, I am angry.
Yep.
So, um, so we have a comment that says by Felicia. Oh, wait. Oh, at Felicia by Dominique. They don't need more culture training. They need to stop being a-hosts and acting on their own bias. They know if their arm was broken, it would hurt. So does ours. Yep.
Mhm.
I think, yeah, and I think that gets to a point that sometimes we like we're too forgiving of
Mhm.
like that whole thing about implicit bias. That's BS.
Mhm.
Like,
Yeah.
yeah.
Because like when you think about like, and one of the things I really have grown to appreciate about the critique, especially from abolitionists who are like, that's their job to like to kill you, right? Like, so I think that when there is a structure that is built on disposing of Black bodies, right? That's not something you can teach away. That is just built into, that is doing its job. Like, and so I really appreciate that, because it's like, no, these people don't just like wake up and, they know, but they're doing their job. So
Yeah. I mean, that goes back to is the part of the quote from Audre Lorde that's the we were never meant to survive. So
mm-hmm.
it's like they
Exactly.
didn't want us to be here. We weren't meant to be in these spaces. We weren't even meant to be getting regular medical treatment.
Mm-hmm.
Property, you don't
We
treat
were
property.
property
You don't treat property, you discard it
when it's
and
not.
create new property. You purchase, you invest in new property. So, like we weren't meant to be in any of these spaces, but we are. And
Yeah.
so we might as well advocate for ourselves since we're here.
Right. I know you think.
Because they gonna call us if they want to call us. Um, so I can read the next one. So it's a quote from page 95, and it reads, if we read that over more deeply attuned to the ways that capital and neoliberalism have I can't read, inculcated greater incompetence for more and more people, we find that what Black feminists promised all along was true: to know the most present marginalized oppressions is to know the future.
Mm.
If we accept that capitalism and neoliberalism and their failures to regulate structures contributes to the exploitation of marginalized group, what role does limiting who is defined as competent play in that process? In other words, how does defining particular groups as inherently incompetent serve efforts to expand who is deemed incompetent enough to exploit?
Oof, that's deep.
Okay, Dara,
Okay.
Dr. Dara, get your question, please.
We're gonna have to break this down. Let's go line by line now.
So, do you want to define neoliberalism for the people real quick? I mean,
You
it's
know,
in the,
my understanding of neoliberalism is that like it's this notion of like less government oversight of social services. This idea that human beings or people, it's individualism, so that we should be responsible for our well-being and everything like that. And so, which is why you get the decrease of social welfare programs, because it's this belief that individuals should be responsible for their well-being, and their safety and all of that. So it's a privatization
yeah,
of everything.
yep. And I think it deeply connects to ideas like the bootstrap
Yes,
myth and respectability. Because
absolutely.
if you just act a particular way,
Right.
you can be successful out here.
If you follow these formulas, right, somehow you too can be wealthy. And
Yep. Yeah, and also, by the way, like many of these terms are on page 9 in the syllabus if anybody is looking for them. So,
the definitions. Okay.
yeah. hmm
Cool. Yeah.
So, back to let's see, the question. So, what role does limiting who is defined as competent play in uh, the process of regulating structures and the exploitation of marginalized groups? And how
Mm,
does defining particular groups as inherently incompetent serve efforts to expand who is deemed incompetent enough to exploit?
mm. Well, yeah, like, I mean, I think we talked about this earlier. Like, if you feel a level of incompetence, you will buy into anything, right? You will buy into things that are serving as markers of competence, whether it be, you know, taking, whether it be aesthetics or taking that extra class unnecessary DI certification. I'm being petty, but you would just do whatever it takes, and with no real recognition of like what, with no real recognition that it, or real, I guess, proof or evidence that it could happen to the lion's share of people, right? Like it's not, we do see all of these like exceptions, and we start to internalize that that can actually be us. When, statistically, if we just think about it, a lot of these things aren't true. So people can be exploited, in that way.
Yeah.
Mm.
I want to, so somebody, or a Facebook user. So if you're on Facebook, it doesn't show the names, just
Yeah.
letting you know. So we're not like being disrespectful or anything by just saying someone commented.
Right.
But I want to talk about this comment. It says individualism is another way doctors have been able to neglect Black fat women. It is that thought that if you lose weight, your problems will be solved. So the doctors get to use fatness as a cop out. I also want to point out a quote from page 85 when
Mm-hmm.
the nurse was talking to
Yeah.
the author about the loss of her child
Yes. Ooh.
right at that moment. And she says, just so you know, there was nothing we could have done because you did not tell us you were in labor. You did not tell us you were. So
Excuse. Yeah.
I was
This.
supposed to know I was in labor, sis.
So
First pregnancy, sis. I'm
I
supposed to
was
know.
like, is this her first pregnancy?
Fir-
Even if it was her fifth, girl, no, because
Wasn't that your job to tell me I was in labor? So going back to this idea of individualism, it's your fault, right? Like if you would have to you're automatically supposed to know like these things that, so it's like so
why
complex.
did you go to school? So if you went to school and did all of this, and I didn't, what? So I'm supposed to also do that, and
Mhm.
so this
And to
undermines
me,
the whole purpose, right?
like to me it is complex in that like we do know that something's wrong, right?
Right.
Like we do know that we don't feel right, like this pain doesn't feel right, there's a pain somewhere where it shouldn't be, and so we come to you to tell us what it is, and when we come to you to tell us what it is, you turn it around and say you should know what it is,
Yeah.
so it's your fault.
Yeah. No, it's called community. I tell you what's happening, and hopefully, if you're listening and willing to try a few things out to figure it out, you will tell me what could be possible and invest in finding out the solution.
Yeah.
That's how this works.
And so that's why it's a relationship that is reciprocal.
Right.
Like it should be anyway. Like I tell you that something's going on. I come to
Mm-hmm.
you, and then you should do your diligence to like make sure that everything's okay.
Mm-hmm.
So, Felicia H said, "Let capital structures run amok." Um, and then Victoria Walker said, "I think in healthcare, incompetence is coded as non-compliance.
Yeah, that's a good point.
So why offer your best services if you know this person isn't going to adhere to medical guidance?"
Right. I let them know because you was
Yeah.
feeling it. Okay.
Yeah. And
Mm-hmm.
like that also look like best services also looks like all options, right? Like you don't provide me, let me know. You also don't do like all of the work, like the blood work that you could do, the imaging that you could do. Like you keep having me come back until it gets worse.
Mm-hmm.
So
Because guess what? Guess who getting them co-pays and them co in the insurance.
and let it be a specialist.
Woo, child. That copay.
I mean, and that's what people with those who have insurance. So
Exactly. You gotta keep it. Let's
yeah.
remember. Mm-hmm.
Oh, I think I skipped a foot. Wait, oh no, I didn't.
Yeah, like two more questions.
Okay. I can, you want me to? I'll read it. So this quote is from page 97. And it says, "This is how Black feminism knows the future." And so the question asks, "In what ways has Black feminism revealed the future to you?"
Mm. Hmm.
So I'll read the first, like the paragraph right before it to like contextualize. So, in that paragraph, it says, "What so many Black women know is what I learned as I sat at the end of a hallway with a dead baby in my arms. The networks of capital, be they policies or organizations, work most efficiently when your lowest status characteristic is assumed. And once these gears are in motion, you can never be confident enough to save your own life. That is how Black feminism knows the future."
Mm. Yeah. I think if I think Black feminism with the is deeply invested in understanding our history, understanding what has happened to us, and knowing that these things are going to happen again, which is why we can project out. It's like, oh, we need to be okay. We need to be looking because we need to stay woke because this is gonna happen again. And I think that's what it means by being in the future is not looking at something as though this is so random and never it's like, oh, this coming out of nowhere. It's like, no, this done happened before, it's gonna happen again. We don't be watchful. And so, which is why we can appreciate people like a Stacey Abrams, who was like, let's go ahead, get these people together, let's organize all of these, voters because they on some BS. So, I think it's that thinking like for having that sort of that orientation toward the future is really about seeing how the past has played itself out and is
Mhm.
currently working.
Yeah. And I'm sorry I skipped to
Yeah,
the last quote, but they're connected anyway. But I just remember when we were reading Black Feminisms by Patricia Hill Collins,
mm-hmm,
and she talks again experiences of Black women as like theory,
mm-hmm,
right? So it is that which is the standpoint of theory experiences, but also it is our ability to come together and dialogue and have conversation with each other about those experiences that then teach us about what it is we need to know when we're navigating this world, and we're navigating this world in the future as well. So like, to me, it's like basically saying the world sucks. They're never gonna believe you. So you believe you.
right.
Believe other women who look like you,
Mm-hmm,
because that's the only way you're gonna survive. If you
mm-hmm,
tell each other your stories
right.
and share your experiences, and talk about advocating for yourself and showing up for yourself, and what that looks like.
Mm-hmm,
So, and I think for her, like this essay, this particular essay, is like part of that
mm-hmm,
Black feminist future. Like she is telling us this story because she's looking out. Like she don't want it to happen to other people, but
yep.
she also knows that it's going to happen to other people.
Yeah, and
So
it's not a sort of a I think people think about pessimism as a type of like you know a negative thing, but like when we talk about even like the notion of like Afro pessimism, for example, it is just an acknowledgement of the ongoing like colonial project, right? It's not necessarily like, oh, you know, and this is why I think you can pick up a Black feminist text written in whatever decades before, right? And it feels like, did you write this yesterday? Did you write this
mhm,
today? Because it's still so relevant, and it's like it's writing for the times, but it's writing because we know again that this is just the experience of Black women,
yeah,
and yes, we are working toward a better future, but a better future is also having providing Black women with the language to be able to name their experiences.
Yeah. Um, Felicia said, Tressie mentioned in a talk, the Black women as a whole,
Mhm.
even though educated, will be poor, die early compared to other groups,
Yeah.
least likely to marry, etc. It's a sad future. And I don't necessarily see it as, I don't know, like I think it goes back to what you're saying, like the pessimism, but also like this is realism, like this is the reality. But we have an opportunity to like change things ourselves. I guess I'm still hopeful, but
Like
a
to
really,
go
huh,
ahead. I just
I,
said, and also to interrogate, like, because I think also thinking about like wanting to have a freedom that isn't always tied to, like, yeah, no, I don't want to be poor, but I also don't want to be, exploiting people, right? Like, and being so rich that, like, whatever. Like, I'm not trying to be Jeff Bezos, but like, I I want to be comfortable, right? I want to be able to support myself. And like, so I think that, us not getting so caught up in like the capitalist version of what a better life for Black women is, but like really thinking about what freedom looks like beyond that. And so like not necessarily, I mean, I'm not trying to like project like, oh, marriage is not a goal for people, but thinking about like what other relationship structures will also benefit us, right? Because being married should not be your ability to navigate the healthcare system, right? Shouldn't be contingent upon whether or not you're married. Like, and I'm thinking about just like if you get put, if you're hospitalized, people can't come see you if they're not married or a
mhm,
family member. So that leaves out so many chosen family, community members that could support that person, but because solely they're not legally married, they cannot access that person. And so, like, can we imagine what kind of systems could exist that are not just like the exact what we consider the exact like foil of being poor or being uneducated or being married, but like, can we think about wanting for Black women other options outside of that that aren't about still tying ourselves to capitalism?
mhm, yeah. Yeah, and I think that's why I said I'm still hopeful. Like when I guess similar to you, when I think of marriage, that's not something that and maybe in the past, but like now, like I don't look at it as the end all be all. Like I see it as like, oh, that's a possibility for
Mhm.
someone, you
Right.
know, and that doesn't mean that it's something wrong with, like, if I never get married, it's fine, and
Mm-hmm.
it doesn't make me less of a Black woman,
Right.
like but I do see like the poor, I think that's relative as well, as you also stated in a way, but I think the key thing is the dying early, and I think when it comes to like this chapter talking about infant mortality, and really it doesn't really state it, but you know the mortality of mothers as well, that we often focus on the baby, but we
Mm-hmm.
don't talk about the life that is um, giving birth or nurturing this baby, because Black mothers die disproportionately as well.
Mm-hmm.
And so, I mean, I think for me, like, it's a hopeful future because I think through stories like this and through conversations,
Mm-hmm.
we can begin to think of different ways to, like navigate um, the medical system,
Mm-hmm.
speak to medical professionals, and also employ alternative options. Um, so, yeah, it's just telling, and we can use this information to create a different future, I think. So,
Yeah.
um, Victoria Walker said, I think this is why there is such a push for Black doulas. Yes.
Yeah.
So, midwives and birth workers. So, there is a protective factor against the medical industrial complex regarding birth. Um, yeah. And so, I think that's like, that is key. Like, if we learn these stories and then we invest in, like in these alternatives, that really our ancestors were doulas and
Right.
midwives and birth
Deliver
workers.
babies at the house.
And that is a form of competence that is often minimized, but it is saving Black women's lives and Black babies' lives. So, and actually in Ohio, they are working on a bill to actually support doulas.
Ooh,
Um, and it's not just black doulas, but
right,
doulas and the work that they do financially, but also giving them more leeway in the medical profession, like because
right.
they are not
Respect.
still recognized for the work that they do. But
Yeah,
but
exactly.
yeah,
Well, y'all. So when will y'all be back?
the
Oh, yeah,
24th.
the 24th. Okay. And
Yes.
go get your syllabus. It's still, still a lot more books to cover. The next chapters you will be reading is Know Your Whites through, I think, um,
Let's know your rights and Black is over or Special Black.
mhm. So
Two
yeah,
very interesting chapters to talk
I
or
know. I'm
essays
ready
to
to dig in. So
yeah.
um,
I will say, so this is your opportunity to like, I don't know, volunteer something. Go do something. I mean,
yes,
like,
what is our call
Black
to
women are
action?
dying, man. This is a
What is our call
call
to
to action right here.
Yes,
Like public health organizations really need the help of other Black women to talk to Black women, Black
hmm
parents. Uh,
right.
so,
Yeah,
and this we have a one last uh,
comment.
comment, and it says, yes, my aunt, who was a pharmacist married to an anesthesiologist, died giving birth to my cousin. My cousin lived, but her mother did not. The degrees and money could not save her, despite what we are told that education and not being poor will provide access. Yes, this is so true. So you can control for all of these things. You can have money. You can live in a wonderful neighborhood. You could have grown up in a middle class or wealthy household.
Yep.
You can have all these things and still die during childbirth, because it is those are not the things that are the reason. Like it's racism uh, that is causing these deaths to
Yeah.
happen. So
Yeah. Thank you
I'm
for
very passionate about this topic. Can you tell?
yes, yes. I'm
Yeah,
glad we spent, the whole hour just talking about the one. So because
yeah,
we go on and on and on. There's just so much there. But
yeah,
yes, definitely to what Dr. Carter said, find your one thing to take this a step further. Even if it's just you with yourself, but it's also good to be in community and support. So
yep.
all
All
right, y'all.
right, y'all. We're gonna see
Bye.
you on the 24th. I
Yeah.
think it's me and
And Morgan, right?
Morgan. Yeah. So see you then.
Bye.
Bye.